So, Linda, I will let you unmute yourself, and Wayne, you can unmute yourselves, and I will stand by and let anybody else in as necessary.
Okay, thanks, Gary. Thank you. Let me set the stage for you, Kayser. What's going to happen is that Wayne Mamie, our president, is just going to take a moment to make a couple of announcements and comments. And then I will introduce you formally as our speaker. And then after we're done with your presentation, there's no hurry. You can have the entire time if you would like. We usually have a little bit of a business to take care of, a couple of announcements and stuff after our speaker is done. So I'm hoping, I'm sure you probably have some remarks you'd like to make to us, and then we'll have some questions that we want to talk about. So with that, I'm going to turn it over to Wayne, and then I'll bring you in, Kayser. Okay, Wayne.
And Wayne, you'll have to unmute yourself, Wayne.
I think I'm unmuted now.
You are.
Okay. Kayser, welcome to our group. And I love to see you in person. Been seeing your great ads. Wish we can vote for you. And keep up the great work. I wanted to applaud. We had our Biden-Harris rally on Tuesday in the morning and one in the evening. And the morning's event, for those that did not hear, went quite well. We had approximately 50 people in the morning. I would say 75, 80% of the gestures or honks were positive. And it went very well. The evening one, we had, I think, approximately 90 people down by the Roses. And what was really great and unusual about that is when I showed up at 4:15, there were approximately 10 or 15 supporters of Trump on the opposite side of Rose's parking lot. And two were starting to filter out over onto the other side. I immediately got out, put some of our signs up on the ground. Probably got a little too close to those maskless Trumpites, but I put signs right in front of their golf carts. And they said, "You're not putting that there." I said, "Well," I said, "use her on the other side." But as the only one there standing, I had faith, like in the morning, that others would show. And boy, they did. Before we knew it, we were outnumbering them 10 to 1. What a beautiful day for Democrats and for the process. We've had some comments from our Democratic members here in Oak Run. Beautiful time Tuesday. One email was very touching where Barbara, I don't know if you're on tonight, Barbara, was hesitant and probably scared to come out at something like that. And she came, had a good time, and talked in the email about being proud that she was able to do something like that and getting strength later on in the evening and listening to Kamala and women like that for strength and to say no to racism and put downs like these people in Michigan tried with the governor. We need to end this immediately. Let's get a blue wave. Let's get a blue wave throughout Florida. Start in Florida and change the world, especially the United States. but I'm excited for the Marion County Democrats. We started the process on Tuesday, the Oak Run Democratic Party, and by golly, I think we had Gary. I don't know if you or Linda. I think we had what 10 or 15 different groups or communities that were involved in Tuesday's rally.
Somebody said they drove from miles away. I don't remember the details, but somebody came in from a community 20, 30 miles away to participate with us. At least
Yeah, we had Marion County Latino Democrats. We had the Marion County Veteran Democrats. We had another club, Wayne, just the general Democrats of Marion
Yes.
County. Okay. And I think we had some women's Democrats of Marion County also. So we had a real nice turnout.
We also had one gentleman from Citrus County. I think he was the one you're referring to, Gary. I stopped over there and also sent an email out to them. I was getting some things for Dana Cottrell, and what a wonderful group over there as well. But talk about the unity, and I'm sure they're passing that message along. And one other topic I'd like to talk on before we turn it over to you, Linda, to introduce Kayser, is I wanted to ask for volunteers for the early voting sites and election day itself to be in front of Freedom Library for early voting, and then to man our locations in Oak Run. Linda and myself, and we had 2 more volunteers for early voting, found it very rewarding over at Freedom. And like Tuesday, we ran into some people that were afraid of some of their neighbors in different communities, afraid to tell them that they were Democrats, and they were good to see a Democratic members out at the polling place. So looking for some volunteers to man the early voting booths over there. And I will send an email out in regard to that.
Okay, I was just going to say.
But I want to congratulate all the Democrats here in Oak Run that showed up on Tuesday, and can also congratulate everybody that didn't show up. We had a wonderful time, and my cats will agree. But right now, I'd like to turn the meeting over to Linda.
Okay, thanks, Wayne.
Thank you.
Okay, guys, I'm extremely pleased to welcome Dr. Kayser Enneking to our group tonight. She's a lifelong Florida and Gainesville resident, and she understands the challenges faced by citizens both in her District 21 and throughout North Central Florida. And as a practicing physician, she's seen in person how the healthcare disparities have affected all of us, our fellow citizens, and that was one of the primary motivators for her run for office. And without further ado, Dr. Kayser Enneking.
Yeah, Kayser, I'm going to interrupt this long enough to mute everybody, and I'll let you unmute yourself because somebody's dog's barking in the background.
Let me.
Everybody's
Okay,
muted.
can you hear me now?
Go ahead. Yep.
Excellent. Well, I am just delighted to see all you guys. I see so many familiar faces, and I'm so proud of you, Wayne. That was just such a great story that you told about that. You know, we have a lake house out not far from here, and there was sort of a Trump boat parade this weekend, and we kind of went down there and looked at them like, you know, they had 3 heads on, and it was right after the football game. So my son starts doing the gator chomp to them, and you could hear him just shut up and go, well, they must be Democrats. But it wasn't, you know, it wasn't, we were not being, I find that oftentimes they try to be intimidating and to intimidate like their idol does, and to, you know, try to shut down conversation because they know they're right, like their idol. And so I really appreciate that you guys are putting yourself out there, because it's hard to do that when you feel like you're kind of there by yourself. I will say that in this campaign, I don't feel, so I'm running for House District 21. That is half of Alachua County. It's all of Dixie County and Gilchrist County. About 83% of the voters live, though, in Alachua County. And many of you know I ran for the state Senate before, and that was how I got to meet many of you. And basically the number of votes that I got in Alachua County, in the western part of Alachua County last time, are almost enough for me to win this election without having anybody from Dixie or Gilchrist County vote for me. So I'm going to admit that I only got in this race because I knew I could win it. And so, you know, some days I feel that confident today, some days I'm not so sure, but every day that I see Joe Biden up is a day that means there's good news coming for us in Florida. And it's just ever so important. The first question that Linda put down for me is what do I think being a doctor will do for anybody if I'm in the state house? Well, there are 77 lawyers out of the 140 people in the state legislature. Not sure that they've done you a whole lot of good during this pandemic. And you know, I think it's clear that people in Tallahassee really don't understand healthcare, and they don't, other than what their own privileged experience has been with healthcare. And they don't understand how hard they make it to get healthcare, and then how hard it is to pay for it. And so what motivated me to run, and you know, initially was around healthcare, but it's around the fact that we need some diversity of perspectives in the Florida State Legislature. There's right now one other doctor, a fellow from LaCanta, who I believe really talks about what the doctors want, but he doesn't do a lot of talking about what the patients want. And I think it's really important to bring that perspective. The other reason why I think it will be very important is I learned during this pandemic that when science moves fast, like it has moved with this pandemic, like it never has before, it's confusing to people, right? So initially it was, don't wear a mask. Well, maybe wear a mask. No, you don't need to have mask. And now there is very clear evidence of, yes, we all need to be wearing masks, and it is the single intervention that will keep us all safe. And so the fact that we have had this politicized is just, it's a shame. It's not just a shame. It is 15,000 Floridians who've given their lives over the poor handling of the coronavirus. And that is just a deep sorrow that we should all bear. But one of the things I've done with this campaign is I've tried to, every Wednesday at 5, sort of explain the weak science of what's happened around coronavirus to people. They've been actually fairly apolitical webinars, but they've allowed me to use my science background to sort of evaluate what's going on and being able to explain it to people that don't have the same background that I have, and to allow them to ask questions about what they might have about the coronavirus. And I remember when we started out, a lot of the questions were about, you know, should I wash my food off and my bags off when I come back from the grocery store? And is it safe for me to pick up a box that's been delivered by Amazon? I mean, that's how little we knew about this. We know a lot more now. I will say that this whole politicization, though, of the pandemic, well, it's just been a huge lost opportunity if you don't look at it any other way. This was an opportunity for the leaders in this country to say, look, it doesn't matter whether you're a Democrat or a Republican, this virus is going to come get you. And we need to fight this in a united way. We need to understand that we're all neighbors and we all want the same thing. We want our families to be safe. And instead, they've turned it into a shit show where people have died. We've gotten more divided, and we've gotten divided over, wearing a mask, which I just find hard to believe, because it's such a simple thing to ask people to do, not just to keep themselves safe, but to keep their friends and neighbors and families safe. And I'm just so disappointed that we missed that opportunity to actually bring this country together in a way that we haven't been together in a while. So that's sort of the perspective that I bring, that I think I can bring to the Florida State House. And it's one that I think they need to hear. I'm not I don't have a big chip on my shoulder about being a woman, but I will say there's only 30% of the House that is female. And I think we need to change that, because again, we just bring a different perspective. I've learned that a long time ago. And quite frequently, our perspective generally centers around what can we do for our community, and not so much what can I do for the top 1% of corporations in Florida that are going to be lining my pockets. I know that sounds very harsh, but I will remind you that right as this pandemic was crashing upon our shores, and as the state legislature was trying to get out of Dodge, they passed a $50 million pandemic budget, and they passed a $521 million tax cut for the wealthiest 1% of corporations in this state. Now, I don't think CVS was going to pack up and leave if they didn't get that tax break from the state of Florida, but we sure could use that money now. And so I really feel like we need new ideas, new perspectives on what we need to be doing in Tallahassee. So sort of enough about that, but you can see, I got into this for a very specific reason, around healthcare. And then I found out that healthcare expertise was really even more important, while trying to run during a pandemic. So you had a couple of other questions for me. And one was, what do you think is the most pressing healthcare issue facing Floridians in particular, but the US citizens as a whole? And, I could put the coronavirus aside for right now, although I will remind you that anybody who has contracted the coronavirus will now have a pre-existing disease. And that will allow insurers, if we continue the assault on the Affordable Care Act, will allow insurers to use that for virtually anything that may be seen as a long-term complication of a coronavirus. And if you think about that, that includes heart disease, includes kidney disease, it includes strokes. It's a whole list of things that we know can potentially be linked back to COVID-19. And so that's an issue, but probably, I think of one of the most pressing issues in the country in terms of people's health is really the fact that we need to improve some basic things. We need to improve things like the availability of fresh fruits and vegetables. I mean, what a boring prescription to come up with, right? Everybody looks at me like I've got three eyes, but that's mostly because you can walk down to Publix and get whatever you want. There are a lot of people who can't find a fresh fruit or vegetable within 5 miles of their house. And that's a problem. That's all of these social determinants of health we know create 80% of the healthcare problems that we see here in the United States. There is a really interesting program that they have done in North Carolina that I would love to see if we could replicate here in Florida. And it starts with actually a referral from a doctor's office. So if you are having problems with obesity and the doctor says to you, well, do you get fresh fruits and vegetables? You know, they can, if they don't live near one, they can make a referral to this program was called NC 360. And so it's from North Carolina. They can make a referral to this hub who will then go out and refer that patient to food banks and to programs that deliver fresh fruits and vegetables to people. And it then becomes the responsibility of that group to get back in touch with the patient. So it's not like the doctor just, you know, looks in their desk for a 3-year-old number and says to the patient, here, try this. In fact, they bring the care basically to the patient. And so it does a couple of things. One is it really has a much higher success rate of joining that service to that patient, but it also in that hub allows us to collect data about what services are needed. So is it transportation that's really needed? Is it problems with housing? Is it problems with food? Is it is it problems with substance abuse? Is it problems with mental health? All of these different things that go into your physical health, that we have systems set up to take care of, but they are incredibly disjointed and difficult for people to navigate to get around them. It's been a very successful program, and I would love to see that replicated so that we really can make sure that we are sort of changing the conversation around healthcare to being more around health, because that's really what we all want. We all want to live healthy lives. We don't all want to go to the doctor every day, you know, or 3 times a week. We just want to be healthy, which sort of brings me to your next question, which was that, and many of you will recall that I really was not a proponent of Medicare for all. And there were a couple of reasons for that, but I will say that I am forever grateful to Bernie Sanders and the folks that were supporting him for moving the conversation about healthcare so that people understood that there are lots of different ways to do this. And when people saw that, they worried about their own personal health care. And so they weren't sure that that's where they wanted to go. And really, that was part of my problems with it too. It just wanted to move entirely too fast. And when you're talking about healthcare, which is something that is so personal and so important for every single person that understands how they are going to get their healthcare, you can't move too fast with that. You have to make sure that you have the system set up to make sure that nobody is going to fall through the cracks. And that's why I'm thrilled actually with where Joe Biden has come out on this. And Joe Biden has the most progressive platform that any Democratic nominee has ever had about healthcare. It just has gotten kind of lost in all the chatter. And the reason why one of the reasons I was not a big proponent of Medicare for all was that it basically exists on the Medicare platform. And as a physician, I see that the Medicare platform really is worked around doing things to people. So if you go to the hand surgeon, he's got a hand operation for you. If you go to the, the GYN surgeon, she's got a hysterectomy for you to do. I'm not saying that doctors do things because that's what they get paid for doing, but I am saying that the incentives aren't lined up appropriately. And I find that we can do this in a better way, where instead of me as an anesthesiologist getting paid because I did a nerve block here and I put a special catheter in there and I did some other whoop-de-doo fancy thing that I got paid for, instead I get paid because you have a good outcome. You know, I don't care how, whatever you want to do behind the magic curtain is fine, but I just want you to make sure that I'm going to be healthy at the end of this. And that's really what I should get paid for. I shouldn't get paid for how I do it exactly. And that, I think we were moving in that direction as Obamacare got implemented, because there was a huge push towards making sure that we were changing how the platforms for how we got paid. But the energy behind that completely fell away with the election of Donald Trump. And we are in many ways back to sort of, at least at the beginning of Obamacare, on many of the initiatives that he had put in. And Obamacare wasn't perfect, but it would certainly, we would be, just kind of close your eyes and think of where we would be today if we had spent the last 10 years trying to make it better rather than trying to tear it down. We would have had this all figured out by now. And that's where we need to go. We need to have a measured program that will get us to a universal healthcare platform, but it needs to be done in a way that is sensible. So some of the things that Biden has done is offered, and oh, by the way, it needs to be affordable. The single thing that I talk to people about is their health care and how expensive it is. And that's because in Florida, we pay more for out-of-pocket coverage, for things out of pocket that they nickel and dime you on. Oh, by the way, that'll be $35 to have your prescription filled. Oh, by the way, that'll be this and that, than any other place in the country. We pay more out of pocket than any place else in the country, and it makes it unaffordable. And we have got to do something about that. Now, much of that, like I said, I'm so thrilled that you guys are working on getting Joe Biden elected, because that is what is going to lead this. But the Florida legislature does have a fair amount of say in how those things go. For instance, one of the things they've done in Maryland is they've set up a board where if you want to raise the price of your medicine from A to B and it's more than 5%, you got to come before this board and explain why the price of that medicine went up and why you have to charge more. You know, I think that we have, that board's only been set up for a little bit less than a year. And so I think we have to sort of see where that's going to go. But I'm pretty sure that would stop some of this gratuitous, price jacking around that we see that is just unexplainable, other than greed. But there are other things. We know that states that have expanded Medicaid, that the cost of the healthcare exchanges, so Obamacare healthcare exchanges, of which Florida has the most people in America enrolled in, we know that their costs will go down by 7%. If you look at states where they have enrolled patients in Medicaid, or they have done Medicaid expansions versus states that haven't, healthcare exchanges, the costs go down by about 7% in those states. So there are things that are under the control of the state legislature that could make everybody's lives happier. One of the cool things about the coronavirus, if I can say that there were any, was the fact that we started doing telemedicine and there were no copays and it was easy to do. And now they're all going, oh, well, the pandemic may not be so bad. Maybe we should backtrack on that. I'm like, no. Let's make sure that we expand this, and let's make sure that we expand broadband so that everybody can get it. These are just things that, again, I think having a doctor in the state legislature will bring this kind of perspective and the voice of both patients and doctors about what works and what works for them. And I think that that's a hugely important thing. Gary, I think you were the one that asked me at one of the Ocala DECs how does Medicaid expansion pay for itself? And I will say that it's taken me probably 3 years to be able to really explain that and that question. And it does it by making sure that the federal government pays a bigger chunk of Medicaid expansion. So people who are newly enrolled in Medicaid, they pay a much larger proportion. Joe Biden would like to actually increase that proportion of what states are getting for Medicaid patients. And so that takes the burden off of how much general revenue the state has to put into Medicaid. So that's one way. But another way is that it creates jobs. It creates jobs in healthcare because it keeps rural hospitals open. It keeps more clinics open because more patients are covered. So that's another way that it does it. Turns out there's a lot of taxes that are paid on all of the healthcare that we get in the state, and they get to collect that, and that's another source. And so you have to kind of put it all in and take it all out and put it all in again. But the estimate currently for how much Florida would reap from expanding Medicaid is about $300 million. $300 million that would go back into our budget that we could spend on something else. And so I think that from both a moral perspective of should everybody have access to healthcare, yes, that's a good thing. But from a fiscal perspective, yes, that's a good thing too. And when we get to Tallahassee with our budget in tatters as it is now, we're going to be looking for where we can find dollars. And I think that this is one area where we can really make a difference, because we know now that where it used to be about 800,000 people were eligible for Medicaid expansion, it's now about 1.4 million because people have lost their jobs in this pandemic. And so they lost their health insurance associated with that. One of your questions on this list was, do I think that that's a good idea? And I would say no. And that's why I think this public option that Joe Biden is pushing is a really good thing. For the immediate short term, he's proposed making sure that COBRA would pay for people's COVID expenses if they got laid off from their job and they contracted the virus. But in the long term, what he'd like to do is create a public option that would allow people to either buy into it or actually have businesses be able to buy into it for their employees. So there's I think what's interesting about developing a public option is it's much more flexible. And I think that that's one of the things that we need so we can figure out what works well and what doesn't. And that's so I'm very excited about the Biden healthcare plan. It builds on what is working, and it takes us to new places to find better ways of doing this. I've talked a lot. I'm sure you get. I can see the eyes glazing over, and I don't blame you. Are there any questions that anybody has for me that I could address? Yeah, Linda.
I want to follow up on your talking about you, because you've kind of moved rapidly through a lot of information there. If I heard you correctly, you don't necessarily think that having to get your health insurance through your employment is necessarily the best thing.
Correct.
Okay.
And I think that this pandemic has shown us where the problem with that is, that when you lose your job is when you need healthcare even more, right? When you lose your job because there's a pandemic, and you think you might have COVID and you need to go get a test, it's really hard to do that if you've lost your health insurance.
Right.
And that was one of the big problems with the whole response to this COVID thing, was that people couldn't get free tests and they couldn't get access to tests. And when they did get a test, the whole system was so overwhelmed that they couldn't get the results back for 2 weeks, and that didn't really help them a whole lot. And so the lack of a national strategy around testing was a huge contributor to where we are today.
Right. Okay, I wanted to follow up about COBRA. If there's anybody else on this group meeting right now that's ever had to use COBRA, I've used it a couple of times. You leave one job and there's a period of time when you need to get some insurance. It's a pretty expensive option.
Yes.
So I just wanted to mention that to you, because if you're going to have any input in the state legislature about how maybe there should be some tweaking to COBRA to make it affordable, that a person could use it as a bridge. But
Yep.
for me personally, it was a pretty expensive
You are absolutely right about that, and it's there. I think the word is usury. That it is beyond reasonable what Cobra charges. Absolutely, but talking about systems that need to be fixed, totally different discussion. How about the unemployment system in the state of Florida, which
Oh my Lord.
even the Republicans have said was designed to fail. Really? That we think that's a good thing, to design a system that is going to fail just so people won't use it, so the governor's numbers look better? Oh, you have got to be kidding me. We need a change in Tallahassee. The hubris of these guys is remarkable.
I've been following this politics since Bush v. Gore, even though I didn't live anywhere near here. And I've been appalled at the raping and pillaging that I think the Republican legislature of Florida has done to the state. And it's not even my home state, but I'm here now, and I really love it.
And they've done it because they can get away with it.
Oh, yeah.
Yeah. When they control all three branches of government, they can get away with it, and we need to break that up. Irv, did you have a question?
Is it Irv? Oh, Irv, you need to unmute yourself.
He's working on it.
There you go. Now?
Yes.
Yeah.
Okay. And I appreciate the point you're making. Now, we have a woman by the name of Barbara Byram, who's also running for this election from our local area. Have you discussed with her, or does she see the buy-in, particularly for the medical aspect? I know she's doing a lot, or she's looking a lot for the environmental, and also looking at clarity in what the heck goes on in Tallahassee. But have you discussed anything with her or some of her counterparts as to maybe a joint effort if you all are lucky enough to get elected?
Well, I haven't talked to her specifically, so let me just say that. And I am certainly sending good vibes her way, because you never know what might happen with this election. This is really going to be an interesting election to see how many seats we can flip, and wouldn't that be cool? But I have talked to a number of folks that are in the House right now, and have really worked on how do we change things. Like Evan Jenny, who is one of the leaders in the House, I finally really had to pin him down about a kind of an arcane point about Medicaid, but and then I said, well, can we put that part of the Medicaid budget in another part of the budget, because I don't think people understand why these things are together. And he goes, yeah, if we're in the majority, we can do anything we want. And that was kind of you can see why it is they don't want to give up being in the majority. But yes, I would say the Democrats will have a very united voice on what we need to get. One of the things that they asked for back in May was a special session. Y'all know about that? So there was a request by the Democrats to have a special session of the state legislature, and they wanted to talk about three things. They wanted to talk about the unemployment system. They wanted to talk about expanding Medicaid, because all of a sudden we had all of these people who were in to reopen Obamacare enrollment. And they wanted to talk about election integrity. Gosh, maybe three things that we should have been thinking about, right? Well, the guy that I'm running against certainly voted against that. And they just ceded to one glove drawn our eminent governor all responsibility for governing. And that's not what they got elected for. They got elected to go up to Tallahassee, even if it wasn't at a convenient time, and to represent us and to try and fix problems for us.
Kayser, you belong to the medical community. And in some of the states I've lived in, I'll just say the state, Texas, for a lot of the medical community they're predominantly Republican, and they had a decidedly point of view about healthcare should be managed, about whether there should even be such a thing as universal healthcare. How are you finding the community that you're in here in Florida? Are there some other Democrats?
Oh, absolutely. I mean, it's a little bit of a sore subject today, and I can go into that on another discussion about how the Republicans use their power to bully groups about endorsements and so forth. But particularly if you look at the demographics of medicine, it is changing rapidly. There are more women, there are more people of color, there are more people who are so frustrated with sort of the handcuffs on us, placed on us by, that we've allowed insurance companies basically to place on us, that there is, the medical community is ready to support change. They, I would say, embraced Obamacare. You know, the old guard was like, no, this is terrible. But the people who are going to be the medical community in the next, 10 years, all of us old people are going to be, retired, and the folks that are coming after me are wildly enthusiastic about healthcare reform. And they laugh and they go, we know we're not going to make any money. And I'm like, well, that's going to be part of the discussion, and it should be part of the discussion. And it should be part of, how we do this. One of your other questions was about a worry that if more people got access to healthcare, that there wouldn't be enough healthcare providers. Well, first, let me say that we've done lots of studies. That was one of the kind of big worries around Obamacare. And so we've had a number of studies now looking exactly at that issue. And it turns out to be a non-issue. The second is about, should we graduate more healthcare workers, essentially? And the problem is not with the number of people, the number of doctors, the number of nurses, that sort of thing. It's their distribution. So to try and get somebody to go work out in Dixie County is nigh on impossible. And so one of the things that the Florida legislature did this year was they expanded some scope of practice around what ARMPs can do. And I mean, here's my take on it. When they were in training, the people that were training them, and their expectation was that they would be supervised. And when that's what your training is, and then all of a sudden you're given a license that says, no, you don't really need that supervision, I think that's dangerous for patients. I think that what we need instead is to make sure, on the other hand, it's also dangerous for patients when the doctors pretend that they're actually supervising that nurse practitioner. That's not appropriate either. And I have certainly seen that kind of bad behavior out of lots of doctors. And so part of it is we need to incent any healthcare provider to go in the rural area and stay there. So if we have somebody who we can give scholarships to and say, we'll pay for you to go through medical school or nursing school, but we need you to pay this back by working in an underserved area. That's all fine and great, except it turns out that Gainesville is also considered an underserved area, which makes no sense whatsoever, right? So they game the rules to suit their purposes, and so you end up with things like Dixie County having no physicians, which is that's why you're twice as likely to die from a heart attack in Dixie County as you are in Alachua County. It's just a horrible mismatch of resources that we have.
Well, that's certainly an issue I hadn't thought of. Jim, you got a question for Dr. Enneking, Jim Carroll. You need to unmute yourself, Jim. Unmute yourself.
Jim, did you have a question? You want to unmute yourself?
Okay, I'm here. As far as prediction, who's going to be the winners and losers in the fight for dollars, given the budget situation this year?
You mean in Florida?
I think that depends upon the outcome of this election. You know, it's about priorities, right? We have the money to do things. It's about what our priorities are. Do we want to pay our teachers and our school staff more money, or do we want to send more money to the for-profit charter schools in Miami? Do we want to expand Medicaid, or do we want to, you know, make sure that Rick Scott's Care Spot gets more business? It's priorities. And I think if we have enough Democrats there, we will be able to shape those priorities. But that only happens, you know, we're only going to fix the unemployment system if enough people vote out these people that set it up. That's the only way that's going to happen. So I think a lot depends upon what happens on November 3rd. And I want to show you what I want to be doing on November 4th is the happy dance. You know, we all want that, right? I don't know what I'm going to do if we're not doing the happy dance on November 4th. And it's, you know, if Canada won't let us all in. So if you thought that was your plan, you know, you got to be careful on that one. And so it's going to take going out to the, you know, to doing the riding with Biden events. It's going to take making uncomfortable calls to people that you don't know to make sure that they've turned their ballots in. It's going to, you know, it's going to take, if you haven't donated, I told my husband the other day, I said, you still have a little bit of money you can donate to Joe Biden. And if you don't do it, you can't complain, you know? So it is, yeah, I mean, it is all of these things. It's all of this effort that it's going to take, but we have got to break up this monopoly in Florida, or we are going to become a red state. We already are in the legislature, but that's not who we are in Florida. We are as mixed as we can be in Florida. And if we allow the Republicans to continue to draw the maps and to continue to be able to use their power to stay in power, nothing is going to change. So that was my pep up story for you guys are doing good work. Hang in there, keep doing it, because we're going to need every single vote from every single part of this state. I will say, at least in Alachua County, because that's the group that I can follow the closest with their SOE, we know that we've gotten about 6,000, actually I have it written down right here something. We had 5,300 Democrats within 5 days of being able to mail your ballots back in. 5,300 Democrats, 1,300 independents had sent their ballots back in, and only 1,900 Republicans. So the independents are voting at the same rate that the Republicans are, and the Democrats are smushing them. So we've got a lot of reason to be happy about this and to get out there and keep doing it, but we've got 26 more days, and we can do this, and we got to do this.
Well, guys, does anybody else have any more questions for Kayser? Linda?
Well, no, mine was, I can't even drag Gary back with me to England. They won't let us in. And besides, they have their own damn problems right now.
Well, I will tell you that my COVID silver lining is that my daughter and her English husband are moving back to Florida. And yeah, so I am, that is my COVID silver lining, but he's not going to be able to apply because Trump couldn't get his way with immigration reform. He just hired 13,000 immigration processors.
Oh, cool.
Right. So we got to make this happen, or they might not come.
Living in two countries where we had a health plan, this is the only
Oh, it's insane.
concern I've ever had in my life living in this country is
Yeah.
the health.
Yeah.
And maybe the guns too, because I was from a different kind of culture, but health. Just so you know.
I completely respect those fears, and I, you know, we have to get the culture changed. We have to get this culture in Florida changed, and you guys are what's going to make it happen. So thank you all very much for being here. I'm going to sign off and
Thank you. Let's give Dr. Enneking a hand.
thank you for having me very much.
Thank you very much.
Thank you,
Take
Doctor.
care.
Best of luck to
Okay,
you in
thanks a lot.
the race.
Yeah.
Thank you.
Okay, guys. We'll take care of just a little bit of business here. In the email I sent out to the entire membership, I let you know what the treasurer's report was, and basically the important number is we have $655.12 in our bank account. Gary, did Biden's check clear yet? Do you know?
I haven't gone to look since the first.
Okay.
I don't know, but yeah, assuming it will clear. They did ask us to give them some information to prove there wasn't dirty money or something. But effectively, we've got a little over $500 net uncommitted in the club's bank account.
Okay. All right. Okay. And then the only other thing, and we don't have a lot of people on the meeting right now, but I'm just going to say I will be sending out an email about the 2021 schedule. And since I do have several board members on with me right now, I want to schedule a board meeting so we can discuss ideas about this November. I'm sure we're going to want to yuck it up with everybody if Biden wins. I just don't know how that's going to happen. So we'll have a board meeting. I'll send you an email. We'll pick a time. And Jim Carroll, with great difficulty, managed to pull together a time for us to meet in 2021. Should we want to be together in person, he managed to get us for the majority of 2021 the Orchid Club at 7 o'clock. There were 2 months that he couldn't get. That was February and September. But even if that didn't happen, we can still meet with Zoom. So we all have to be flexible and understanding as we work our way through how we're going to handle our schedule in 2021. But Jim and I and the other board members felt it was important to have a physical place to go to if we did decide we wanted to be together in person. Does anybody else have any more comments on that or want to weigh in on that? Okay, Irv, you got something? And you got to take your...
Unmute, Irv.
There we go. Okay. Can you hear me now?
Yes.
Yeah, I think you may have got my comments earlier about whatever room we get, we hang on to just because maybe somebody else, some community service group may want to borrow it from us. But I think it's whatever we can get onto, it would be a good thing. Also want to latch on the idea I got some sort of half commitment from the Citizen editor. We know his political proclivities, but he said if I get enough pictures to him and maybe some comments and stuff, we should have a splash in next Friday's Citizen. So if anybody has any other pictures, Gary sent me a couple. I think Wayne sent me a couple. So if anybody has any anecdotal information or anything else, could get to me before noon tomorrow, that would be cool.
Okay, I'll send you a couple of comments. I don't think our pictures are very good, but if I find one that looks good, I'll send it to you. Okay.
That'd be great. Thank you.
Okay. There's pictures from the Riding with Biden and the Biden-Harris rallies you're talking about.
Yeah, from our thing,
right.
Tuesday. Thank you.
Okay, well, so it's pictures for our rally on Tuesday.
Correct.
And did you also want pictures of the Riding with Biden thing?
Well, when is that?
That happened on the other day.
Last Saturday.
Oh, well, then I missed that, obviously.
Okay. So if there's any pictures of that, we could send them too. Wayne was there.
Yeah, whatever we can get for it. We need to preclude these idiots running around with pickup trucks with Trump signs hanging out of the back of them.
Okay, all right, okay. Any other comments, questions, concerns? Anything? Okay, all right, guys. Well, then, thank you very much. I thought Dr. Enneking was very informative, and we need more like her in the legislature, don't we?
We do.
We do. Okay, thanks, guys.
Gonna go now.
Bye. See ya.
We're recording soon.
Okay.